those who could not be on the call today. So if you're joining us on the recording, welcome to the webinar, and we're just going over the agenda right now. So the bulk of today's call will really be devoted to this demonstration of our updated evaluation report form. We will finally, whoops, if you could hit the screen again. What we'll end the call with is upcoming dates to know and some reminders and next steps. And then with that, I am going to actually turn it over to Christy Kaolakai to give a welcome from the Colorado Health Access Fund team at the Denver Foundation. And I think, Christy, you are unmuted now.
Great, thank you. And thank you, Jeff and Karam. The CHA Fund has so much to be excited about and so much to be grateful for in 2020. And I just wanted to give a few remarks. Last year, our partnerships helped 13,000 individuals receive therapy and or substance use treatment. Since 2015, that means 87,000 people have received care. And my team, which includes Cindy Willard and Shannon Love, are always so proud to work with each of you and your organizations. We have so much gratitude for friends in the safety net who work on behalf of the community and the individuals that you all serve that have very intense needs. So first, just to thank you. Second, we are grateful to add Karam Ahmad to the evaluation team with CHI. And finally, we have added a staffer at the CHA team, and that's Shannon Love. She is our Associate Program Officer, and we are so pleased to have her join our team. Knowing that, I also wanted to keep you all informed and updated on some of the new strategies that the fund has. I'm going to go over them very briefly. Of course, what brings us here today is our core strategy and where we spend most of our time and funding, and that's increasing access to treatment. The other strategies include safety net workforce support. That looks like a $4 million four-year investment in the provider loan repayment program that is exclusively for behavioral health providers. We've also invested $1.5 million over 4 years in public policy advocacy. We have 9 partners, very busy right now during the legislative session, advocating on behalf of behavioral health and the safety net. We also have one more strategy, which is safety net innovation, and that is in partnership with other funders. We have invested in the Colorado Colorado Health Innovation Community. Several of you are part of that community, and we hope to infuse the safety net with truly innovative practices. This includes a couple of our current and former partners, Clinica Family Health, Every Child Pediatrics, Mental Health Center for Denver, and Stride Community Health. Thank you for those of you who are engaged in that really important work. But changing gears and getting back to the focus of what we're talking about today, evaluation is a core value of the foundation and the CHA Fund, and with that, we rely on CHI to help us. We have worked with CHI, since 2015, and they are a voice that the foundation and many others trust. On that note, I'm going to hand it back to Karam and Jeff.
Great, thank you so much, Christy. And we are honored, as I mentioned before, to be working with each one of your organizations as well as the Denver Foundation to carry out this evaluation of the Colorado Health Access Fund. My one regret with today's call is that we are limited on time and we don't have a chance to go around and do an introduction of every single organization that is represented today. But we wanted to give you an idea of who is on the phone today. And so the 3 current cohorts of grantees that we have, cohorts 5, 6, and 7, are represented here. You'll notice that there are some organizations that actually have 2 current grants that are represented here today. It's a really impressive list of organizations around the state, and I know many of you work together with partners that are represented on this list as well. So just wanted to give you a brief glimpse as to who is represented on the phone today. And then finally, before I turn it over to Karam, I briefly wanted to review the guiding principles for the evaluation of the Colorado Health Access Fund. So we've identified 5 principles that guide our evaluation from year to year. And we won't spend much time here, but just wanted to remind you of these. So first and foremost is that what we really aim to do with this evaluation is to embody a learning orientation. The Denver Foundation is committed to ensuring that evaluation activities are first and foremost useful for you, the grantees. And therefore, this evaluation will lead to the development of a shared body of knowledge through facilitated sessions like this one with grantees and through the evaluation process itself. We have a couple ways that we do this, that we embody this learning orientation. First of all is by learning through the self-directed grantee evaluations. So Karam will go over this in a little bit here, but this is the portion of your evaluation where you really carry out those activities, those evaluation activities that you outlined in the proposal that you submitted to the Denver Foundation. And also, we hope to foster a culture of learning through learning opportunities like this one, and as well as a panel on program sustainability that will give you a reminder about that's happening next week on Wednesday that you are more than welcome to attend. The second guiding principle for the evaluation is really maximizing the usefulness of the evaluation. We don't want to create an evaluation that's just going to sit on a shelf and collect dust, but we really want to make sure that it is useful not only to the Denver Foundation, but also is useful for mid-course corrections of you, the grantees, and that it's useful for us as evaluators too. The third guiding principle is around owning the evaluation, which by this we really mean that the evaluation is owned not only by the staff at the Denver Foundation and its advisory committee, but that you all are able to adapt your evaluations to really help apply the learnings to the important work that you're doing in increasing access to behavioral health services for Coloradans. Sustainability is an important guiding principle. The Denver Foundation is committed to ensuring that the work financed by the Colorado Health Access Fund continues after the fund ends. And this principle really requires grantees to continuously apply lessons learned and address challenges and work towards becoming sustainable without funding from the Colorado Health Access Fund of the Denver Foundation. And as I mentioned, and we'll give you another little plug for this at the end of today's presentation, we will be hosting a virtual panel session next Wednesday about program sustainability. And then finally is informing policy. So the evaluation really does represent an opportunity to identify those barriers, those policy barriers or legal or regulatory barriers to increasing access to behavioral health services, or identify policy opportunities as well. So we're committed to this evaluation informing policy. So with that, I am going to turn it over to Karam, and I will be monitoring the public chat feature if you have questions or technical issues. And Karam's going to be walking us through our new and improved evaluation report form. So take it away, Karam.
Hi everyone. So yeah, I'm gonna walk us through what sort of the reporting process will look like for your evaluation this year. It should look like very familiar. If you're a grantee that has filled out this form in previous years, it should look very familiar. And for new grantees, welcome. This form has been tweaked and updated, and hopefully this process will be a lot more streamlined and straightforward. You know, the goal at the end of the day is we want to have sort of one point of contact where you can submit everything. So what I'm going to do today really is walk through the reporting. The reporting form is where we collect really all of the good work that you all do, from understanding the reach that you guys are that your programs are making, to the impact on the communities, to understanding how effective the models you're using, and understanding sort of how you're interacting with stakeholders and how they're adopting sort of the work that you're doing, to knowing like what's working well and what are the barriers to doing the good work, to being able to do the good work that you do in your communities. This tool, this is really our main instrument for evaluating change and for evaluating the great changes that you are making for the lives of thousands of Coloradans every year collectively. This year, you know, we really wanted to reduce opportunities for error. We really wanted to create sort of a one-stop shop for submitting all of your evaluation data and financial reports. So what we've done this year is we're using SurveyMonkey. I'm sure many people are familiar with SurveyMonkey as a reporting or survey tool, as sort of the tool where you will be submitting all of these materials. So this year you're gonna, so those of you that have been that have submitted forms in years past, so this is what this year's grantee reporting form looks like. It should look the same. You know, we changed sort of the title just to give it a new look, but I'm going to sort of just do a quick walkthrough of what this form looks like, and this is really going to be the place where we're calling this this Word document the reporting template, where you can fill out all of your information, and then you can use this document to copy-paste your answers into SurveyMonkey. And the idea for having you do that is it will reduce the opportunity for error. It will allow us to aggregate your data much more efficiently, and it will allow us to sort of do follow-up with you and troubleshoot with you if we have any questions that come up in your reports. We'll have direct access to your reports, so we can more directly address those needs. We want to make this easy for you this year. So the reporting form this year, there aren't any like huge changes at the end of the day, other than this form is going to be sort of where you will put in all of your answers before you submit them on SurveyMonkey. So, you know, the beginning of the form, still sort of the administrative information. This is where you submit the name of your organization, contact information, that sort of thing, the type of grant that you were awarded, dates covered by the grant. All of these are very straightforward questions. These have not changed from years past, and for those of you that are new, these are just administrative questions that are used internally by the Denver Foundation staff. And then where we go from there is really where we dive into what we call the Ream Framework. And for those of you that might not be familiar with the Ream Framework, this is where, so Ream stands for Reach, Effectiveness, Implementation, Reach, Effectiveness, Adaptation, Implementation, and then Maintenance / kind of sustainability, how you're sustaining your program. And then we add this extra letter P, so 3AIM-P for policy, because we want to get an understanding of how the policy context in your community or in the greater state of Colorado is impacting the work that you're doing. So you'll see each of these sections will have one of those letters associated with it. So the first section is reach. This is really where we're trying to capture the individuals that you're serving. So we ask some sort of demographic information. We ask for a breakdown of sort of the rural-urban split for where the work is being done, where the clients are, where they're from. We've added some clarifying language here to make very clear, like we want to understand where the clients are for the work that you're doing. And then we dive into sort of who are the target populations. These are target populations that the Colorado Health Access Fund and Denver Foundation was interested in improving the lives for, so we want to capture that. And so all of these sections should be very familiar if you've looked at this form before. I would say it's 95% the same as last year's form. This 10th question is really where we capture like the number of individuals that you served in the last year, or in this grant period, in your last grant period. And what we've done in this section is the notable change from years past is, and it's not that great a change, we just want to, we've put together tables for you to break down sort of the percentages of that population that you're reaching. We want to have an understanding of, at the very least, we'd like to know the insurance status, the race and ethnicity of those populations, and then if you have additional information like primary language spoken, gender, these are all sort of optional demographic information bins that we're interested in collecting and understanding if you have that data. We recognize that not all organizations have that capability or have that data available, but we wanted to make that available. And so what I'm doing right now is sort of walking through what the questions look like. This is the template that you'll fill out, and then I'm going to sort of show you what it looks like in SurveyMonkey. It's going to look identical. So you're like all the answers that you're going to put into this table are going to transfer identically into SurveyMonkey. Sort of the next series of questions that we ask are on understanding the services that were made available through the funds that you received from the Colorado Health Access Fund. So this is where we're asking about the types of, you know, if you're doing counseling sessions or inpatient treatment. This is like, we want you to quantify really how many of those services are being provided to your best ability. And then we've also added some questions that, or some options for you to elaborate on those services. The next section is touching on effectiveness. So with the different types of work that you're doing, what have been sort of some key successes for those services that you're providing, and what are some sort of critical success factors or achievements that you can illustrate here? That's really what we're trying to capture. So we want to know the type of work that you're doing, and we want to understand really what's going well. What are sort of the factors, or you know, internal to your organization or external, that were critical to the success. The next section is adoption, and this is really where we try to capture buy-in internally from your staff at your organization, and buy-in with the stakeholders that you from the get-go said, you know, we want to work with. If you're doing work with schools, are schools bought into your program? Are local police officers bought into your program? If that's a stakeholder that you from the outset wanted to work with, this is the section where we really want to capture that. And you'll see on this question 23, it'll say fill out the adoption table attachment. This will be a separate table, very straightforward, where you will talk about what group you were interested in sort of getting that buy-in from, what worked well, and sort of doing a self-assessment as to whether you had full adoption, some adoption, or no adoption, and sort of this self-reflection. The template for this adoption table was sent along with this template from Jeff yesterday when he sent out these documents. It's a one-page document where you'll be capturing these things. And that's an attachment that you'll be including in the SurveyMonkey reporting form. The next section, we really want to sort of capture what are challenges for your organization to really implement the work that you're doing in your communities and with the target populations that you're interested in working with. So this is where we sort of capture those challenges and how they impacted your program. We want to get a good feeling of what measures are you taking, or how is your program going to be maintained or scaled up or augmented in the future. This maintenance and sustainability question really works to capture that. And then, like I said earlier, the P in the Ream plus P is policy. So how are the outside forces of policy, and this can be big P, big policy, statewide level policy, or laws that are being enacted that might have implications on your program, or small p policies, things that are happening locally, or even within your organization. How are those things impacting the work that you're doing? And then we have this section where we want to capture some of the special sauce of the work that you're doing. What are some lessons learned? What are some recommendations you would give other organizations that are trying to do the work that you're doing, for example? There are many organizations working on access to behavioral health care. The goal of this section is to capture some of those best practices so we can put them in a report and share them with everyone at the conclusion of this next grant year. And then, these are the focus areas of the foundation, so it's always nice to just get an idea of the distribution of the different kinds of work that grantees are doing. Are you doing, and this section, some organizations are touching on all four of these different kinds of work, but we really just want to capture and get a gist for, a lot of grantees working on access to care? Are they working on transitions in care? Are they working on innovations like telehealth or mobile clinics? Or are they doing sort of education outreach or education sort of services? And then the last two sections, so this section D, the self-directed evaluation results, this is really where we try and capture, we want you to self-reflect at your organization and think through what's working in your program. This is your chance to sort of share how you've used data or qualitative, quantitative data, internal team meetings, whatever process refinement looks like at your organization. This is where we would like to see that captured. We have a couple questions that touch on that. We also have we have an option for you to upload data that's related to this, and we'd like to get an idea of sort of how are you thinking through evaluation yourself. And then finally, this last section is the financial documents. This is the more like administrative documents that the foundation, that the fund, is interested in capturing just for administrative purposes. So this is your audit, your balance sheet, your budget status, that sort of stuff. So that's sort of the walkthrough of what the questions are going to look like for the report this year. I'm quickly going to pull up what this is going to look like in SurveyMonkey. So the questions are identical in here, and like I said before, what you're going to want to do is use that Word document as sort of your like master document for where all of these answers will be stored, and then when it comes time for you to submit your report, you'll go to SurveyMonkey. It should take, SurveyMonkey has like an estimated time that your survey will take. Actually inputting all of your data from your Word document to SurveyMonkey should take 30 minutes to an hour, so long as you have everything done in your Word document. Transferring that information should be straightforward. And what we've done on SurveyMonkey, we've reminded you what documents are required, what documents you'll need to upload. It'll include that adoption table I mentioned, those 3 financial documents that I just touched on. And, you know, I've included my contact information and the fund's email information as well if you have any questions regarding this form. But really, the form is identical in SurveyMonkey. So where you see asterisks are where the questions are required, and you're going to get an error message that's going to pop up if you don't answer those questions, or if you answer them improperly. Like if you put a word in place for a number, for example, you'll get an error. But you know, these questions are identical to the ones that I walked through earlier, where we've added some more ease of use in here is where we capture some of the reach metrics. You know, previously we've asked grantees to think through and list out all of the counties or different communities that they work with and quantify those sorts of things. We've made it a lot easier with checkboxes and the ability to just check where you do your work. And yeah, so you know, overall, I'm sort of just scrolling through these questions, but they're identical to the ones in the template, and you should be able to transfer all of those with ease. I think where the questions where they look a little different are where you have these options for uploading documents. So in the section where we're capturing sort of the demographics of the populations that you reach, we've added this question, or this section where you can upload your own custom document if you, for example, are tracking populations beyond sort of these more generic big picture demographics that we're looking at. So if you're tracking persons experiencing homelessness, or those with a history of trauma, or some sort of more highly, like a smaller population that doesn't really fit into those bins, you have that option to upload a document. Like I said, you know, the rest of these sections, they are identical to what it looks like in the Word document. This is, you know, I mentioned that adoption attachment. This is where you will attach that document, where you'll provide some sort of supplementary explanation for it as well. But yeah, I don't really have to go through every single one of these questions because they're identical to the Word document. Where you will submit your financial information will be at the end in the form of 3 different attachments, just Word or PDF attachments. And then we're also, right now it says other stuff attachment. I'm going to change the language for that, obviously, but that will be an area where if you have any other supplemental documents that help illustrate the work that you're doing, anything that you think that the fund or CHI needs to see, you can attach it there. We wanted to make sure that you had sort of an opportunity to attach any other supplemental, other stuff related to your evaluation. So the way that, let me get back to our slides, the way that you're going to get access to SurveyMonkey is we have an ask for you at the end of this presentation, and Jeff's going to touch on it again, but we're going to ask that you know, every organization tends to have one contact, or, you know, a team of people that work on these evaluations, but typically there's one person who will send it in. So we're going to ask that you identify a contact and share their email address with me. My email address will be shown up on the screen at the end of this presentation, and that person will receive a unique link that can be shared within your organization. So the concern that some people might have with SurveyMonkey is not having only one chance to go in and enter in your information. That's not the case here. We've created a survey reporting form where you can go in and jump out, where you can share that link with other people on your staff that need to submit information, and they can go in and jump out, and it will automatically save your information in SurveyMonkey until you submit your report. And even after you submit your report, like if you really had to make any changes, there's an opportunity to still make changes to your form. You would just have to reach out to us. What I think is important to emphasize here, though, is the so I already said this. Every evaluation report lead is you're gonna get a link to a custom form. There is a checklist for attachments that you're gonna need to submit on SurveyMonkey, and you're gonna be submitting all of this as decided in their contracts. So for a lot of you, I think that's going to be in September later this year. But reference your contract, and you'll know when you need to submit that. And then yeah, so at the beginning of that Word template, you'll see a checklist of what you need to submit. So you're really going to use that Word template as sort of the catch-all for all of your answers. We highly recommend that you fill out that form, the Word document first, so you have sort of an analog copy of all of your answers, and then go through the activity of just copy-pasting your answers into SurveyMonkey, so then we can aggregate all of your data together. And then, like I said, you can always go in, edit, and revisit your report through SurveyMonkey through your unique link. Edits, like I said, edits can be made even after you exit out of the survey. And then, just to further emphasize, the link that you receive is going to be unique to your grant. So every grant, I know there are a couple of grantees that receive multiple grants, but those grants are paying for different programs or different capital funded projects. We want to capture those individually because they are unique programs and they are unique initiatives or building projects. So you will have a unique link for each grant. So if you're an organization that has multiple grants, you're going to have 2 links. And just as a privacy measure, just forward it to colleagues and who are actually going to be working on the evaluation form. You don't want to send it to someone that's going to go in and make erroneous tweaks to it. So, and then this is obvious, but you're going to complete and submit this report. If you've been funded for multiple years, you're going to be submitting this once a year for the duration of your grant. So if you're doing it for 3 years, you're going to submit 3 reports over the next 3 years. And really, that's sort of like the overview of everything. At the heart of this evaluation is the great information that captures the great work that you guys are doing. So we wanted to reduce the opportunity for, there are 30+ grantees, and we want to make sure that we get all of your data and we get it in a way that's streamlined and in a way that where we can follow up with you, in a way that we can troubleshoot with you and get you the help that you need. We're always here as a resource, as the evaluation team at CHI. Yeah, so that was a lot of me talking and a lot of information at once. I'm gonna open it to questions. So I want to hear from you. And
so far, we don't have any questions.
No questions in the chat. Hopefully that's a good sign. Hopefully that means it's been straightforward.
If you do have questions, feel free to just type it into the chat feature, and we will field those questions. But in the absence of none, I'm going to just keep going. There might be some that trickle in here over the next couple of slides. But I wanted to, I'm going to move on and just provide this reminder. Excuse me, I'm getting over a cold, so I apologize that I'm coughing. So I wanted to provide the reminder for the Zoom panel. So this is a virtual panel on program sustainability. Many of you will remember that we had originally organized a learning circle, which was going to be an in-person meeting of all the grantees back in October of 2019, which we unfortunately had to cancel because of weather. Well, one of the features of that learning circle was a panel on program sustainability. And we were so enthused about the panel that we decided to offer it at a later date. So that later date is next Wednesday, February 12th, from 9 to 10 a.m. It's going to be a fabulous panel that features Vanita Curry of the Curry Consulting Group as a facilitator, but it also includes some past and current grantees of the Colorado Health Access Fund reflecting on their own sustainability factors for their programs, as well as Dasa West from the Denver Foundation representing the philanthropic viewpoint. So this panel will really be doing a deeper dive into issues not only of financial sustainability, but other factors that contribute to program sustainability after grant funding ends. So we will plan to record that and send out the link to the recording once we get it posted. So if you are not able to make it live next week, you will be able to watch the recording. And if you have not already RSVP'd and you're interested in attending, please contact Karam, and I've listed his email address here at the bottom. It's ahmadk@coloradohealthinstitute.org if you would like to attend. And he was also copied on the email that I sent last night that contained the attachments for the survey form template as well as the slides for today. So you can look for his email address there as well. Just a couple other reminders, if you could advance it there. As Karam had mentioned, the deadline for most of your reports for the 3 cohorts that we have represented on the phone is September 30th of this year. And it is generally on a cycle of September to September, or August to September. So just wanted to remind you about that. We will be planning to send out the link to the SurveyMonkey probably in early summer of this year. So we do want to know the name and email address of your primary evaluation report contact at your organization. We'd like to know that soon. So please also email that, coordinate within your organization as to who's going to be the primary contact, and send Karam send us that information by Wednesday, February 12th. So that's next week. And all you need to do is just send a quick email to let us know that. I also wanted to also just remind you that we do not have a Grantee Learning Circle, an in-person meeting that's planned for 2020. So that's a change from, for some of you who have been involved in the Colorado Health Access Fund for a while, that is a change. It looks like there is a chat that came through. Yes, it was a question about can we resend the email that I sent last night and a special request to one particular grantee. I will send a follow-up email after this phone call to everybody that includes the attachments again, just in case you didn't get it the first time, as well as Karam's email address and a reminder about some of these deadlines and RSVPing for the panel and everything, so that you can make sure that you have those.
And we will also put those materials on our website with this recorded session as a reference as well, and we'll send an email out when all of that goes live. It should be within the next week or so. Yeah, within the next couple of days, you should get an email from me that has all of this information plus the link to where this webinar is going to be, where you can access it, and then we will make sure to post the
report template both on CHI's website, and we'll follow up with the Denver Foundation as well to make sure that that gets posted on their website and that we've taken down any older versions of the report template. So seeing no other questions that came through, could you move it to the next slide? Just wanted to thank everybody for joining today. If you could unmute Christy. Christy Kaolikai, do you have any closing remarks or any comments or reminders or announcements?
No, thank you. I'm just very grateful for everyone's participation today, and I want to thank CHI for streamlining the evaluation report. We hope that this minimizes our outreach to you all and asking for additional information, which I believe it will. So thank you for that.
Great. Excuse me. Thanks, Christy. And thank you to all of you for all of the good work that you are doing around the state, expanding access to behavioral health services and substance use disorder services for Coloradans with high healthcare needs. We also wanted to just say congratulations as well for your grant awards and for the great work that you will be doing in the year ahead. We look forward to hearing from you and to eventually reading your grant reports. We have our contact information for Karam and myself here on this last slide. Feel free to reach out to us with any additional questions. You can email us or give us a call, and we'd be happy to answer those. If you do have questions specifically about your grant, those would best be directed to Christy Kaolikai at the Denver Foundation. So with that, we will wrap up, and thank you again for your time. I think we're wrapping up a little bit early, so you have a little bit of time left, a little bit of time back in your afternoon. But thanks in advance for your work on your evaluations, and we look forward to working with you in the year ahead. Take care, everybody.
Thank you.